Hi, I'm Scott Garrison, a family doctor at the University of Alberta. This video is meant to supplement a talk I'm giving on hypertension, where I mentioned that family doctors can potentially validate their patients' home blood pressure monitors in their office using a T-connector. Home blood pressure monitors are hugely useful. The problem is that for about 20% of us, they're off, inaccurate by about 10 millimeters of mercury or more for either the systolic or diastolic blood pressure. So it's important to check whether for a given individual the monitor is giving an accurate reading. The trouble is that there is no validated way to check the monitor's accuracy in the clinic. Most of us, if we're doing it, are having the patient bring in the monitor, get it to spit out a reading, check the blood pressure on our own with our own equipment, and then see how close they are. The trouble with that is if we're not getting the same reading, we don't really know if it's because the monitor is not accurate for that patient or if the blood pressure really changed in that interval. Perhaps simply because it's the doc that's now measuring the blood pressure, which in some people might put the blood pressure up. I think that the way around that is to do simultaneous blood pressure readings. We're checking it at exactly the same time as the monitor is checking it using a T-connector, which connects the home monitor to our sphygmomanometer. I'm going to cut to the clinic, show you how I would do that in the clinic, and then I'm going to cut to my garage and show you how you can simply and inexpensively make one of these for yourself. Okay, let's head off to the clinic.
Okay, so here we are in my clinic, and with me is Anna, who's my research assistant, who's kindly volunteered to play patient. Anna, do you want to say hi?
Hello.
And obviously Anna is not in the perfect position to measure blood pressure, legs are dangling, no back support, cuffs on her left arm. None of that really matters because I don't really care about the absolute value of the pressure, just whether or not I agree with the reading from the manometer. I'm using the left arm because I normally ask patients which arm that they use it in, and most of them use it in the left simply because often the machines tell you to do that because the cinching is made to be more easily put on if you're right-handed using your right arm. So on the wall here is my own manometer, which has recently been validated, and what I'm going to do is connect in with the T-connector the tubing so that the tubing from my manometer connects to the tubing from the home monitor. So the way I do that, right here is the quick connect that I would use if I was going to change the size of the cuff. So just undo that and instead connect in the T-connector, same way I would add in a different size cuff. And then now I want to add this so that the tubing is connected, and you can do that right where you see this adapter that's going into the home machine, right? There's a little plastic piece here. You have to pull that plastic piece off. So we do that. There's the plastic piece. And then this little rubber arm here is what you connect the plastic connector to. Okay. And then this other side is where the tubing goes onto. I normally try to push it all the way if it will go, which it does, just to make a little better seal. And then this goes back in the machine. Okay, so you can see all of these are connected so that they're in the same circuit. This is going to see the same pressure that this does. Okay, so the machine is going to control the inflation and deflation, and I am going to listen to the Korotkov sounds. At the same time as it's doing that, I am looking at my own monitor, checking the blood pressure exact same way that I normally would. It's just that I'm not doing the inflation, the machine's doing the inflation, and I'm going to compare to what it gets. So let's see what it looks like. Oh, to be young. The new machine says 106/73. I got 108/74, so actually that's really close. Ordinarily, I would do this twice. If I get the same thing both times, then I stop there. If I get a number which is different, then I'll usually repeat it. But until I'm satisfied about whether I think the machine is accurate or not. That's all you do. So now let's cut to my garage and we'll show you how to make one. So this is what a T-connector looks like close up. You can see that this end has the male end of a quick connect, which looks like this. So in your office, you probably have a quick connect like this, which attaches to the tubing that goes directly to the manometer. And when you're changing out different cuff sizes, large, medium, or pediatric, on the end of that different cuff, there is one of these male connections, and you're just pushing those in or out to make the change. So you want, ideally, to make it easier for you, you want one of these in the end of the T-connector, so you can move it in and out quite quickly. The alternative is to have just a straight 1/4 inch barbed connector. This is for sprinkler systems. I got this from Lee Valley. It's called Rain Drip. And if you don't have a Lee Valley near you, they actually have an online store and they'll mail it to you. It works fine. The disadvantage is that you would have to pull out the quick connect from what's the manometer on your wall in order to attach the T-connector with this. So it's much easier to have a T-connector. You can order those from a medical supply store, or you might have a cuff that you seldom ever use, so you can just take the male end out of that if you have an old pediatric cuff, or again one that's seldom used, and put that in the T-connector. Okay, so attached to that is tubing, and you don't want it to be longer than you need it to be. In my case, 18 inches works fine for the office setup that I have. It's latex tubing, which I ordered from Amazon. You can get other 1/4 inch tubing. For instance, there's this clear vinyl, there's this PVC tubing. They're both the right diameter, but I would not use these. The reason is that they grip plastic connectors too hard when you put them in, and you may struggle to get them out. You don't want that to happen with your patients. The little adapter that the home monitor uses, on the off chance that the plastic could break. That's never happened for me with latex tubing, which is much softer, much more flexible, and I've done this on a lot of monitors. The other end looks like this, and that has a T-connector, a 3-way barbed connector for 3-way air access, and that would fit right there. Those are also part of a sprinkler system, also from Lee Valley. They're called 1/4 inch barb tees. They come in packages of 10. They're quite inexpensive. And then also on the end is this latex piece here, and you can see that I've folded back, sort of doubled back the end. The reason for that is that, here's one that I made last night. The reason for that is that that's the normal diameter for the tubing. You can see when you fold it over, it's actually a little bit smaller. Some of the connectors that you need to fit into here are smaller, and this is slightly too big for them. If you fold it over, this turns out to be just perfect for the larger size and for the smaller size. It's small enough to make a seal, but latex is flexible enough that it can accommodate a bigger piece of plastic that you're trying to put in. So, oh, the other thing is that this is, hopefully you can see this, there is some glue right around the lip here. And the reason for that is to stop it from flipping back over again, which it would do if you didn't glue it down. And for gluing, I would just use shoe glue, which is a good glue for gluing rubber, and it's also somewhat flexible, which is helpful. The only other thing I would do is if you can see here, and compared to one I have not done it to yet, this edge here I've filed down to make it beveled. Right, this one is not beveled. The reason for that is that some of the tubing from the home monitors, when you push it down, it will not make a seal with the barb. You want to be able to push it down the full length. And so, but some of that tubing as well will struggle because it'd be too narrow to go over this bit. So if you just take down the lip, don't go too far. You want the back part of it to be wide still. But you just bevel that to make it easier to push the tubing on. And then I've been able to get all the tubing, all the monitor tubing that I've tried to fit. Okay, so let's put one together. So here, again, it's about an 18-inch piece of tubing. I would take the male end of the quick connect, put that in that end, so that's that end done. And the other end, we would get the barb T and put it in, push it all the way. Okay, and then to make the side end, you want about a 2-inch piece. Now, to fold that back, it's sometimes a little hard to do it just by hand. If you have strong fingers, more power to you. You'll probably be able to do it. I managed to do it this time, but sometimes it can be a struggle. You can work to get it down a little bit more, or there's a trick that if you have a round file, if you push it down onto the file, when you pull it back, it'll naturally fold itself over. And sometimes it folds too much and you have to get the edge to come back out. Oh. Okay, and then you can just work it a little bit to get it folded over as much as you want. That's pretty good. Yeah, okay, so take that off. Okay, and then I'll apply the glue. Just put on the lip. Ooh, I probably took off got a little more glue than I would have wanted there, but that's okay. Just on the lip. Okay. And we'll let that stay overnight. Sit it on a toothpick so it's not gonna fall over. Okay, so let's put one of these together. I finished putting one of these together. I've got there's the end there. It's dried overnight, so that will go in here. And again, I would have beveled that edge right there. It'll take a minute or two to do that. I'm not going to have you sit and watch me go through all that, but that's your T-connector. So hope it works for you.